It's springtime. What a beautiful time of year. The ice is melting, the flowers are blooming, the birds are singing, the bugs are thriving. Wait, what? Yeah, you heard that right. The change in weather brings not just the sunshine, but the insects. The butterflies, the bees, those pesky mosquitoes, the fleas, and not to be forgotten, the ticks. Along with them, ticks can bring a whole bunch of problems. One of them, Lyme disease. This tick-borne illness can cause serious, long-lasting damage in not just humans, but our pets too. Dogs are particularly susceptible due to their time spent outdoors. This video will teach you what Lyme disease is, how it spreads, its symptoms, its diagnosis, its treatment in your dog, and maybe most importantly, how you can prevent it. Lyme disease is caused by the bacterium of the Borrelia classification. Ticks are carriers of this bacteria and can transfer it via their saliva. So let's be clear, not all ticks are carriers, and not all ticks are infected with bacteria. Now, there are several species of ticks in the United States. Each goes through 4 different life stages: egg, larva, nymph, and adult. The nymph, or the juvenile ticks, are mostly responsible for the spread of Lyme disease due to their very small size and their inconspicuous bite. Of the many species, black-legged or deer ticks are the ones that carry and spread the Borrelia bacteria. You may have heard of other types of ticks like the dog tick, the Lone Star tick, the Rocky Mountain wood tick, but those are not ones that we're going to focus on in this video, and they're not a cause of concern when it comes to Lyme disease. Deer ticks belong to the Ixodidae family, of which there are more than 700 species. Ixodes scapularis, or more commonly known as the deer tick, ranges from the eastern states all the way into the central and northern Midwest states. Ixodes pacificus is the predominant vector for Lyme disease along the west coast of the United States. As an adult, this tick has a dark brown body, a black head, and 8 black legs. When engorged or fed, its abdomen appears swollen and grayish-blue in color. Ticks are often found in not just heavily forested areas, but also landscapes that have tall grasses, bushy undergrowth, and they may even hide under leaf piles and around stone walls or wood piles. Ticks will wait among the plants and trees until a host animal passes by, and they can hitch a free ride and get a meal. If your dog has access to these environments or accompanies you on hiking and camping excursions, you must be especially vigilant about watching for these parasites. As a dog owner, you should comb your fingers through your dog's coat every day. Start at its head and run down its body slowly, remembering to look in ticks' favorite hiding spots, dark, moist areas. So this means you need to check your dog's ears, their armpits, their thigh pits, around their groin, under the collar and the harness, and yes, even around their genitals and their anus. Be sure to thoroughly observe any red spots that your dog has been scratching, as well as watch out for licking and head shaking, as these are all indications that something is bothering your dog, even if you can't see it right away. Okay, so you found a tick on your dog. What next? Studies show that the sooner the tick is removed, the chances of transmitting Lyme disease decreases. If the tick is attached for over 24 hours, that rate of transmission goes up. You'll want to promptly and efficiently remove the tick from your dog. There are many myths out there about burning it, submerging it in nail polish remover, or alcohol. All of these are just that, myths. In fact, they can make matters worse and can be very dangerous. Just a disclaimer, do not hold a flame near your pet's fur for any reason. It's just an accident waiting to happen. To remove the tick, you need a pair of tweezers, or you can buy a tool made specifically for this purpose. If you have neither, you can use your fingers, but it's wise to have a pair of gloves or a napkin, paper towel maybe, to shield your hands. Grasp the tick as close to your dog's skin as possible. This parasite feeds by burying its head underneath the skin, so try to get as much as you can. Firmly grab that tick, just pull straight up and out. To kill it once it's out, you can put it in a small cup of rubbing alcohol. This allows you to examine it to determine the species before disposing of it.
How long after a tick bite would I notice my dog experiencing symptoms?
Most of the dogs are going to start showing symptoms about 3 to 4 weeks after a tick bite. Some might be a little shorter, some a little longer, and it also depends on the amount of exposure that they've had to. If they were just bit with one tick, it might take a little longer. If they were exposed to multiple ticks at one time, that might come on a little bit sooner.
What are the first symptoms that I would notice?
Most dogs are going to show up with some sort of lameness in the front end, so a front leg lameness, oftentimes an off and on lameness or even a shifting leg lameness. So they may start limping on the right front leg for a day or two, it gets better, and then it might shift and show up in the left front leg. Usually at the same time, they're going to be running fevers, so they're more lethargic, they're laying around, they're less willing to get up and play. And oftentimes their appetite will decrease during those times when they're running the fevers as well. So particularly when we see a dog come in with decreased appetite, a front leg lameness, and a fever, Lyme disease is the #1 thing on our list.
If not treated early, are there more serious symptoms that could occur?
There are. Oftentimes it will progress, so if that dog comes in and they're just mildly limping, it may progress to the point where they're more sore and they're down and out. But probably the most severe symptom that it could progress to is kidney failure. So it's a bacteria that most of the time will target your joints, but every once in a while, and it's pretty rare, but every once in a while it can go to the kidneys and cause severe kidney failure. And if that's the case, then it's very serious. It can be life-threatening.
How do you diagnose Lyme disease?
The most common way to diagnose it is with a blood test. Most clinics will have an in-house test that they can run. Literally takes a drop of blood, and the test can be ran in-house there. In 10 minutes would have the results. Now that test is going to be looking for antibodies. It's going to show you, has the dog been exposed to Lyme disease at some point in their life? And then oftentimes we'll correlate that with any symptoms that might be going on. So if you have a positive test and they're showing symptoms, and especially if they have a history of having ticks, you can pretty much count on Lyme disease.
If diagnosed with Lyme disease, your vet will most likely prescribe a cycle of doxycycline. The cycle usually consists of 200 milligrams once a day for 4 weeks. In some cases, a longer treatment cycle may be necessary. Your vet may also prescribe anti-inflammatory meds to aid in pain management. You should begin to see a change in your dog after 48 hours of beginning treatment, and in most cases, recovery will be complete.
Some would say that the best offense is a good defense. This is also true when it comes to Lyme disease. Fortunately, there are many different options when it comes to protecting your dog. There are different types of medications that can be used to treat your pet. These medications rely on chemicals that paralyze and/or kill ticks at various life stages. These medications come in different forms, including oral medications, topical treatments, and collars. All 3 forms are effective, but you should always consult with your veterinarian to make sure what is best for your pet.
The first option is to get your dog vaccinated. Your dog will get an initial vaccination and then get a booster up to 4 weeks later. Then your dog will receive annual boosters. Also, the vaccine only protects your dog from diseases caused by the bacteria Borrelia. It is important to treat your dog for tick infestation using other methods.
Oral medications are a simple way to treat your pet. Some popular brands of oral medications include NexGard and Bravecta.
Depending on the brand, you will administer your medication to your pet every 4 to 12 weeks. Each treatment is an chewable treat that your pet will take easily. Just open the package and give it to your dog.
Currently, the most popular form of prevention is the use of a topical medication. Some popular brands of topical medications include Advantix and Frontline.
Topicals are designed to be administered on a monthly basis. The topical is applied down the back of your dog. Once you open the package and the applicator, you'll start at the tail of your dog. Make sure to get down to their skin. Slowly dispense the topical as you move from the dog's tail up to their head.
Finally, you can use a medicated collar on your dog. Some popular brands would include Seresto and Verbec Preventic. The benefit of these medicated collars is they're good for up to 8 months. To place on your dog, you just need to open the package, remove the plastic connectors, place around your dog's neck, ensuring that it's not too tight. You should be able to fit 2 fingers between the collar and your dog. Finally, trim off any excess from the collar, making sure that there's at least 1 inch of give.
Your friends at Forest Hills Veterinary Clinic would like to remind you that by using a form of prevention and avoiding high-risk areas, you'll be able to decrease your pet's risk of contracting Lyme disease. Thank you for joining.